Qualitative research in clinical trials. When health professionals approach patients about clinical trials, they're keen to provide patients with information on the trial in a clear and balanced way. This helps patients to make an informed choice about taking part. However, various factors can make it challenging for health professionals to provide patients with clear and balanced information, and can make it tricky for patients to fully understand trial information. For example, patients can feel overwhelmed receiving information about a trial, especially if they have only recently been diagnosed with a condition.
I couldn't have told you when I come out of the clinic of anything that they said. You're absolutely blinded by it, you don't take it in, you're still thinking, is this real?
And health professionals often appreciate that information about trials can be a lot to take in for patients, and many wonder how best to deliver this information.
I think patients find it hard. The trial is complicated, isn't it? I think that the rationale is complicated, and what they would be getting outside of the trial is complicated.
Researchers are conducting qualitative studies within clinical trials to examine whether there's anything more that can be done to support health professionals in providing patients with clear and balanced trial information. Dr. Francis Sherratt tells us more about how researchers do this.
I'm Dr. Francis Sherratt, and I work on a qualitative study that's embedded in a clinical trial. These sorts of qualitative studies aim to identify and address challenges that health professionals might encounter in discussing trials with patients. I work closely with health professionals such as surgeons, nurses, and oncologists who approach patients about trials. Often these studies involve audio recording trial consultations between patients and health professionals, interviewing patients on their experience of being approached about a trial, and interviewing health professionals on their experience of approaching patients about a trial. Qualitative studies often produce lots of data. We transcribe audio recorded data, such as consultations and interviews, anonymize them, removing names and places, and safely store transcripts here at the university before analysing them. From the consultations and interview transcripts, we look for patterns and themes in the data. We tend to continue to collect and analyse consultations and interviews until we're satisfied no new major patterns and themes are emerging that we haven't already identified. The findings can then be used to support health professionals in enhancing their trial consultations with patients. In past studies, we've identified issues that are important to patients in relation to their experiences of being approached about research. For example, one patient who was informed of some clinical results immediately before discussing a trial with a doctor explained, "It would have been better for me personally if maybe I'd had the results and maybe an hour or two later or the next day come back to talk about the trial." Qualitative researchers feed back their study results to health professionals to support them in enhancing their discussions with patients about trials. This might, for example, include opportunities to optimise when the trial is discussed, which aspects of the trials are discussed, and how these aspects are discussed. I found feedback very helpful. It was useful to hear what other people were doing and saying, and it either reaffirms that what you're doing is right or it gives you other ideas.
Overall, qualitative studies embedded in trials can improve patients' understanding of trials, enhance health professionals' confidence in approaching patients about trials, and encourage more patients to participate in transformative research.